Hi there. Today I'm with Craig Martynuck. He's a psychologist working in Ontario. He's been practicing there for some years. Today we're going to be talking about PTSD, and he's going to tell us a little bit about that condition and other things within his practice. So I'm going to just open that up with that. Craig, can you tell us a little bit about your background and what kind of population you work with?
Yeah, well, thank you for having me, Kelly. My background comes from a place where I've been a psychologist for about a decade now, but leading up to that, I feel like I have some connection with this PTSD first responders. My practice, for the most part, now deals with first responders, anxiety, depression, PTSD, typically related to their job, and so I believe I'm well suited and have a lot of personal experience. I have worked as a first responder. I'm a volunteer firefighter as well as a search and rescue volunteer and Coast Guard auxiliary. I've been married for 28 years, and not to say that that's trauma, but my wife was a first responder. My 4 kids are first responders. And so the population that I work with has, for the most part, primarily now police, fire departments, paramedics, dispatchers, corrections officers, customs agents. And so there's a lot of carryover both in my personal life and my experiences and with this population.
You and I also worked years ago. I first met Craig when we were working frontline with youth who had a lot of emotional challenges related to past traumas. And so we had some experience, I think, in working with kids that had quite a bit of trauma, complex trauma. So you've got that background as well.
That's the interesting part. I think that is one area that probably does not get recognized as creating symptoms for PTSD, but working with highly dysregulated young people, there is that sense of both you're trying to connect with them and help them, but also because of their struggles, they put you at risk. And being a young person, they're not considered a threat, but they very much are, just by the fact that they can't manage themselves very well.
Mm-hmm. Yeah. Lots going on for those young people. But your current population, your work is mostly adults.
Yes.
Firefighters, police officers, first responders.
Yep.
Yeah. And so with that population, what would you say is it about the first responder population that puts them at risk?
Yeah. Well, for the most part, our body is designed, and so is our common sense, to run away from danger. Like our natural instincts, the way our body is wired, is that we're to protect ourselves. We're made to survive. So we got a lot of natural and biological and psychological constructs in place that say, hey, you need to take care of yourself. So typically that means move away from anything that can cause you harm. The challenge with first responders is their job is, and they've made a commitment, is that they actually run towards harm. So the very nature of their body and their psychology is going against what they're doing. Mm-hmm. So it causes at some level a miswiring or rewiring about and against your natural mechanisms for survival. And so a part of that is the fact that they are running towards danger when everybody else is running away. They're also having to go opposite of the way the body's wired. So typically when people undergo a stressful situation, they can't think very clear. And your body wants to take off on them, and their emotions want to take off on them. And being a first responder means I literally have to be and do exactly opposite of what everybody else is doing. I have to think clear when everybody else is not thinking very clearly. My emotions have to be almost paused or turned off because I can't get caught up in everybody's emotions. When there's an emergency, a crisis, everybody starts to get anxious, and that triggers people. I also have to be at a place where my problem-solving skills, I have to be well-trained to deal with a situation that most people are not trained for. So even that part of me, I have to be able to pull up skills that I've trained for in order to keep people safe. And so all of that almost as doing the exact opposite of how I'm wired to do it. So you do that for a long period of time under extreme situations, it's almost inevitably going to cause some effects on you that aren't positive.
It takes its toll because you're going against your body's natural inclination.
Yep.
Yeah. So what does PTSD look like? What are some of the symptoms you're experiencing in that population of individuals that, do that great job?
Yeah. Well, at some level, it differs depending upon what job you do. So at some level, police and their activities will be different from dispatchers and different from paramedics and the exposures that they have, what they're required to do. But the interesting part is that, PTSD is kind of a clinical diagnosis according to the DSM that says in order to have the title or the diagnosis PTSD, there has to be certain criteria that's met. And it's broken up into about 6 categories, and each of them you have to show symptoms in each of these. The reality is that the effects of trauma are cumulative, and they're also almost on a spectrum. They start creeping in and they start subtly at first and potentially they will last for a while and then go away. But slowly but surely they start to increase both in intensity and frequency and the amount of space that they take up in your life. So from a clinical point of view, where a person crosses a threshold of just having a stress disorder or anxiety situation into the level of PTSD, you're going to see symptoms like sleep dysregulation. So having a hard time falling asleep or else waking up in the middle of the night, typically around 3 o'clock tends to be a magic number. You might have work-related dreams and or flashbacks and or nightmares. So there's kind of a retelling of the things that you've been experiencing. There's hypervigilance, which says, my job is to keep other people safe from danger. And so my nervous system starts to get wired that says, I start looking for danger even when I'm not at work. And that will show up in simple things like having an arousal overreaction. Somebody can call your name and you can jump out of your chair, or you walk into a room and you instantly want to take a seat so that you got your back so nobody can sneak up on you. You don't like crowds because there's too much stimulation. All sorts of ways it says, I am expecting danger, even when it's not reasonable to expect it. And they call that hypervigilance. Mood dysregulation is a big one. It says, my moods aren't typically very stable and or they're overreactive. And so my nervous system is wired higher than it should be. And also in a crisis, you typically lose the ability to be in a good mood. So if my mind and my nervous system are stuck either getting ready for a crisis or believing that the crisis is still on, I lose the ability to have joy or to have happiness, to smile, to have a sense of humor. I become pretty somber. I become pretty reactive, might be even considered, to people who know me, cranky. And that's on the lower end of the scale. Some people start to have quite significant anger outbursts and which are not characteristic for them. Cognitive impairments is another one. I can't think straight. Again, in a crisis, when there's so much information happening, you typically zoom in on one issue. Well, if you're not actually in a crisis, your brain is still not able to be flexible enough to think clearly and integrate information that I need for daily living. So my memory starts to go. My focus is gone. I get to the grocery store and I can't remember the 3 things that I'm supposed to pick up, but I can tell you the license plates of the cars in the parking lot, because at some level, maybe if I'm a police officer, that represents my way of operating and keeping a situation safe. Emotional numbing is kind of the opposite, which means being in a stressful situation, in order to keep my mind, solid, I learn to turn my emotions off. And that's effective for me in a crisis situation, because I don't want to overreact and feed into somebody else's stress response. So I tend to turn mine off. Problem with that is that I become very accustomed to not having emotions. And so that works great when you're in a crisis, but it does not work well when you come home and you lose the ability to connect with your spouse or your kids or your neighbor. It's like if you want to put out a fire, you put a wet blanket out on it. It puts it out for all the situations. So I could literally not feel anything. And that's one of the key things is people say, nothing upsets me anymore because I'm so used to seeing such incredible situations that most people don't see. I've stopped reacting to everything.
And that personal disconnectedness too. So they can't feel things, or they at least stave that off. So they're disconnected from their own selves, their own emotion, in addition to the community and relationships that are important to them.
And that leads into social distancing, meaning I start moving away from people because people are unpredictable, and I deal with all sorts of unpredictable situations in my job, as well as it takes emotional energy and positive emotional energy to be with people that you enjoy. And if I don't have it, if I've turned it off, I will feel very alienated, and I'll feel very much like I don't belong around people anymore.
So they start to isolate.
They start to isolate and alienate, as well as they start to have a sense that nobody else understands me. Nobody sees what I go through every day. And so I lose my friends because I can't talk about my job. Nobody would get it. You know, there's the confidentiality issues. There's also the sense that the job that I do is, you know, sometimes I do things that I'm not proud of, and I wouldn't want to share that with other people. And so it leads to a person feeling very disconnected, or if they are connected, they only can connect with their coworkers, because they all kind of share the similar experiences. And that normalizes it. And that's a challenge. You don't even recognize that you are, you know, moving away from who you originally are, because there's other people giving you feedback that says this is normal. And you lose the ability to compare yourself against the rest of the population. So your symptoms actually can become quite severe, and you not know it because you'll see it in your coworkers and you say, well, that's me. Whether that's addictions issues, whether that's dark humor, which says we laugh about things that the rest of the population would think, oh, that's, you know, inappropriate or disgusting. And to us, that's kind of the only way we know how to let off steam. So
I know an inspector in the Edmonton Police Service who, one of the things that he would keep saying, it's kind of like a litmus test, that he would say to, you know, his colleagues and people that he's supervising, is that make sure that you keep your everyday friends, not just police friends. And he thought that when you depart from that too much, it was a bad indicator of mental health.
When I have chatted and done treatment with particularly police, that is the first place that we look at where they start to lose their sense of what was holding them in their space that they started with. Policing and first responding is its own community with its own belief systems, its own culture. And at some level, to be fully integrated into first responding, there's a sense that I have to move away from the world that I came from in order to both learn and to be accepted and to be successful. And that often becomes the first place that we start the treatment process, is how do we connect back with the strengths and supports you had before you started to get in trouble? You know, and that's like, wow, I haven't talked to my civilian friends in like 10 years, you know, and I don't even know, they probably don't want, you know, at some level we start to project and we say, oh, they probably don't want to hang around with me. I haven't chatted with them. And when I'm the one that has moved away from them, if I'm the first responder. So sometimes, you know, challenging belief systems like that, you know, also, as well, some of the effects of, or the symptoms of trauma is, you know, depression. That's one of the key things, that I'm exposed to so many things, and my nervous system and my emotional system are just so fatigued with so many dark things I've been through. And I start to feel hopeless and helpless, and I don't have any joy in my life. I stop. I lose the interests that I've had, my hobbies, the things I used to enjoy that, you know, were ways for my brain to switch channels from all the heavy stuff that I carry. I don't even feel like I have enough energy for that anymore. And so I literally start losing connections with all the things that, were part of my life and kept me healthy before all this stuff started.
Right. And that combination of shift work and that more insular community, they feel isolated.
Yes.
Yeah.
Yeah, that's one of the key components that a lot of the police officers I talk about is that nobody understands our world. We're invisible. Essentially, we deal only with kind of people on their worst days and, a small component of the community. We're disrespected. People, our society has changed in terms of how we consider, policing for sure, in terms of the respect that previously was due in another generation, where to be a police officer was highly regarded and highly esteemed, and tides have changed, and now it's seen as something that would be not attractive, and a lot of people throw insult and criticism for these men and women that are actually putting their lives on the line, and it feels like such a betrayal of the expectation of how I should be treated. I'm literally putting my life on the line for the community, and people are calling me names, spitting at me, disrespecting me, and so there's a high sense of both disconnection and a sense of not being appreciated, and to do all that work. So at some level, it becomes a community that supports itself because there's no supports outside of it. And a lot of first responders like that. I don't want to just isolate policing, but certainly that is one of the highest professions that show PTSD symptoms and depression and anxiety and high divorce rates, high addictions rates. There's all of the bad indicators show up highest in that in the military.
So with PTSD, I think a common association with the condition is that there was some kind of event that precipitated or led to, difficulties functioning. So it sounds like you're also saying, yes, in addition to that, of which you can ruminate and have dreams and day visions and these kind of things, it can also be a cumulative effect.
Yeah, in fact, they have changed the legislation recently. Previously, it used to be that, you have PTSD, tell us the day, what happened, give us a date, give us an incident, nail it down to one, they call it index incident. And now they have, and based upon some very serious situations that occurred, they have recognized that it is not a one singular event situation that leads to first responders getting in trouble. And so they changed the legislation that they call it presumptive legislation. If you're in one of the careers that I had originally identified as a first responder, we're just going to assume that the exposures that you get day in and day out will inevitably lead to your situation. So they have, stopped the requirement for demanding, give me a date and a time when everything started happening, such that, because a lot of people would say, you're talking about, one situation, I can give you 40 of them. Which one should I pick? And, how many assaults, how many incidences of sudden deaths, and like, which one should I pick if you want me to write one down? And so it's late in the game, but I'm thankful that it's there, because it really did minimize the work that those people do, where you and I may have, an index incident that would say, wow, I remember everything about that call or that situation as a civilian. It would burn in our brain. First responders deal with 2 or 3 or 4 of these index incidents per shift. And so it just becomes normalized when it's not normal at all. But in order to get through their shift and do their job the way they want to, it does mean I stop recognizing the significance and the severity of the things I'm exposed to, but it still affects me. And there's the challenge. It kind of goes undercover. I don't even recognize that I'm getting damaged, because A, I'm expected to do it. B, the culture that I grew up or that I work in is such that everybody has been through it. And so there's an expectation that nobody's going to have an effect, as well as the whole culture and belief systems regarding mental health in our community at large, but specifically in first responders, has been largely ignored or minimized or even mocked. So if you're a person that prides yourself on professionalism and doing your job well, and the reputation and being seen as competent in your job, for the most part, you're not going to say anything, even when things start to go offline. I don't want to be accused of being the weak link at work. I don't want to go off work with WSIB. I don't want to admit it to myself that I'm getting in trouble. So there's some barriers attached to the mental health component for first responders that is slowly being addressed, but it's still pretty predominant. And so there's lots of areas that need to grow. Slowly but surely, we're moving there.
Yeah. And that's, you could just see that it definitely takes a toll, especially on those populations where, say, if I see a patient and they've got PTSD symptoms, we'll look at, well, what precipitated the event. But when you're working in a job when there's so many of those precipitating events, that the accumulation of those things really takes its toll on people. Yeah. So, in keeping with that, is there hope for this population? Is there? I mean, they're doing a great job for society. The job is going to take its toll because of we're not geared to be taking that level of emotional difficulties day in, day out without it having some effect on us. So how can we address this? How can we treat these type of conditions?
Well, a big part of it, I believe, comes first in helping first responders recognize the job that they do and the fact that it is to be expected for the effects to be happening. I try and change the paradigm, or at least how they view themselves. And I say, you guys are elite athletes. You're called and can do jobs that most people in the community can't do. And if we were to put that and say, not everybody can play the NHL hockey, and not everybody can play NFL or CFL football. The people that make it there are elite. And thus, with that, though, they are put in situations where they take a lot of abuse. And if you're on the hockey rink or you're on the football field and you're constantly, when you're working, when you're good at your job, you're good at sports, you're constantly receiving physical impacts. Okay, whether it be hockey or football, rugby, you name it, your body is taking a beating in you being elite. And so we don't consider that that's somebody separates their shoulder or somebody gets a concussion, or we don't say, oh, that person's weak. We literally say, oh, that person needs care. And if you're playing hard, you have physical therapists, you have massage therapists, you have chiropractors. You literally say, in order to do my job well, I have to take care of myself. That same mentality has to move into the first responder world that says the jobs that they do that most of us can't do, it does have a toll, and that it should be an automatic expectation that they would seek help. And first of all, that they would be expected, in order to stay good in their job, that help would be offered, and not just after the symptoms show up, but hey, you do need. And this part of, I call it the maintenance program, just like you change your oil in your car. And the faster you drive your car, if you're in the Daytona 500, you're going through tires fast, you're going through oil fast. You need a pit crew around you to keep you. First responders run their lives, especially when they're working, as if everything is a crisis and that everything is so urgent that we need to make sure that they are functioning well. So part of that is dispelling the stigma that says mental health is a sign of weakness, rather than this is what keeps me strong. So literally flipping that on its head. Hey, I'm going to, and I'm working with a lot of the police officers and the first responders that I've worked with and have come off work, and we've kind of rewired their thinking, their belief systems, changed their attitudes. They have now gone back into their workplace and now are the greatest promoters. They become part of the peer support program, and they become the ones that are dispelling and going to their coworkers because they have eyes that says, you're in the same place I was last year, whatever, and I've got to recommend that you do something about it, because if you don't maintain your car breaks down. If you don't maintain your mental health, you break down. So better to go for an oil change and rotate your tires rather than breaking down and needing a tow truck when you can't drive anymore. So that's one of the key components, is changing how a person sees themselves.
It's a very common part of at least policing, that they work out. They in fact get paid to work out. It's a very physical job.
Yes. Yep.
I wouldn't want to wrestle most police officers. So, well, any police officers for that matter. But it's a very physical job, and it's just innate that they know they need to work out.
Yep.
So it would be nice that more innate, because it's a very emotional job too.
Yep.
That they take care of their emotional well-being too.
Yeah. And I would say for all first responders, they're literally dealing with people who can't and are past the point of taking care of themselves. They're in an emergency and they need somebody else to help them. And so first responders are the ones that say, I will step out of my comfort zone and I'll go into your crisis zone and I will help you. And that's pretty amazing for how they're treated, the wages that they get, the impact, the price that they pay, the price that their families pay, their mental health, their physical health. They're heroes in my eyes for sure. And so as society becomes, a little bit more unwound and unraveled, and what the traditional pillars that hold our society up are starting to erode a little bit, the pressure on them goes up. And so we need to be really thinking about how to support them, and for, professionals like ourselves, what are the best ways that we can, keep them healthy? And for ones that get in trouble, how can we make them healthy again? So just a couple of things. PTSD, it touches all areas of your well-being. So one of the things, typically, how to get sleep regulation. If you're not sleeping well, your mental health will go down really quickly, and your ability to think straight, your ability to make wise decisions, emotional regulation. So often sleep is one of the first and big hitters that you got to look at. Also mood regulation, giving people the skills to deal with the ups and downs of a situation, often that they're not in control of and that they're called to manage. And so not being taught, how do you communicate in a way that allows you to express and release how you feel in a controlled way, not going passive where you hold it all inside and you feel like you're going to explode. And conversely, the flip side that says, I let myself explode and I get myself in trouble. How do you find that middle ground? Another one, you mentioned exercise. The body is one of the key tools that, if you use it properly, can help you manage your mental health. So good nutrition is a huge one. But the exercise part, the diet, your body and your mind have such an inseparable bond, and they talk to each other. And when one's off, it'll take the other one off. And so I have to make sure that my physical body is well taken care of, and exercise being a big part. It is a place where I can release a lot of mental stress, and I can go and I can focus and I can feel power, and I can feel my body will take care of me. And it also helps me to release adrenaline and cortisol, all the stress hormones that are released into my blood, and do it in a way that's not attached to trauma. So I literally learn to bring my body down to a place where it can start to rest and relax and refresh without using artificial substances. I don't need alcohol. I don't need drugs. I don't need anything else. I literally am training my body to release all the nervous energy. Another one is some of the treatments that are used is because PTSD is a mind-based disorder that shows up in all the areas of your body and your life. So there's a rewiring that has to happen. You got to consider, your belief systems will have changed. How you communicate will have changed. How you think about yourself, how you relate to others, even at some level, how you believe that there is justice in this world. And so I see, your religious belief systems can be challenged. And if you don't come from a religious background, even your sense of, is there justice in this world? Is there any sense that there is hope? Because if you give your best and nothing changes positively, you start to feel very hopeless. Okay. And that's one of the key pillars of depression is that I feel like nothing that I do can ever make a difference. And so at some level, from a survival point, I stopped trying. And I may not even say I quit trying, but slowly but surely my energy stops showing up and I start feeling like it's not worth the trouble anymore. And so I start disconnecting from all the areas of my life, my family, other things that bring me interest and joy. So we actually have to say, wow, you have changed the way you think about everything. We got to revisit those and say, who were you before? And that ultimately is the place where you're healthy. How do we get back there? Because in order to survive, and especially in the first responder world, you're focused on disaster and danger and death and all sorts of sadness. And that starts to become an expectation. That's all the world can offer you. And so you start to lose the ability to feel joy and even start to expect trouble at every, and there's where the hypervigilance comes from. I expect something bad's going to happen to me all the time. Well, that's not realistic. But if your mind thinks it, your body will play it out and it'll affect everything in your life. So they call cognitive processing therapy is one of the treatments that have been designed to help a person recognize that they have literally shifted their thought patterns about everything and to bring them back in. It's a slow erosion. I often will talk to police officers today. When you first joined the policing, why did you join and what did you expect would happen? And how did you treat people? And they'll say, wow, I had totally forgot about who I was when I started and why I started and what I expected from this job. And now I just have a completely pessimistic point of view. And if you're pessimistic about your job, it will then translate into how I connect with everything else in my world. Mm-hmm. There's also things that deal with, there are situations that get burned in a person's brain, like things that cause flashbacks and nightmares. And so those are like my nervous system has got stuck on an event in my life that has not been able to be turned off. And so it's as if I'm stuck, Groundhog Day in a situation and an event and a belief system, and those get stuck. And so my body will stay stuck wide open, believing that I'm still in danger. And so you often have to take a person back to those events and allow them to have an experience and a new belief system that says they actually are safe and that my body can calm down and relax, and that I do have safety and I do have security and the crisis is over. I've passed through it. PTSD at some level, I describe it as a stuck state of being in an emergency, even when the emergency's over. And so either I'm stuck in the old one or I'm getting ready for the new one, but I can never have a relaxation period in between. And so if I don't give my body and my mind a chance to relax, just like even a car, if I'm running full blast all the time and I don't stop and get an oil change, I don't fill up my gas, I eventually will break down. The body or the mind cannot run full blast all the time.
Yeah, and some of those big events that you're talking about, because there will be some of those that even stand out, trauma-based therapies, those kind of things are great ideas to help to attenuate some of those symptoms. Yep. Is there anything else, just in the last minute or so of this conversation that you would like to add?
Well, PTSD is not reserved only for first responders, and certainly I would give first my admiration for the work that they do, but as well as the impetus, not just for first responders, but for everyone. Everyone does go through trauma in life. Okay. It doesn't always mean it has to, create such dysfunction, but it does change you. And if you're not aware of it and you're not working towards self-care, it starts to build up and it slowly takes you away and you don't even recognize that you're not the person you used to be. And so self-care regarding relationships, self-care regarding our emotional health, physical health, even our spiritual health. A big part of the world now has, I think they're grasping for something to give meaning to life. And I think you can't ignore that. I think people do have to spend some time and say all the areas of my life have to be stabilized and at some level have some directionality. They call the buzzword is mindfulness. I literally have to have a sense of direction and purpose for all the areas of my life. in order that I can steer my life in a direction that I want to go, and that leads to health and leads towards me staying connected with everybody else. That's really where the action is. And if I have any evidence of my life, and maybe I got to ask the people around me, a big part of PTSD is you don't even recognize you're in trouble. It takes somebody else in your world to speak into your life. So if you know somebody in your world that you can see them getting in trouble, bring it to their attention, because they probably don't know it. And be prepared that if somebody brings that to you, that you're going to say, people are going to come to me in love and caring. They don't want to see me get in trouble. I should be prepared to accept that, not as a sign of weakness or that I'm flawed, but that people care about me and that I have the potential to, at some level, resilience part of me that says, I don't want to return back to normal, because I can never, but I can get better. I can be wiser, and I can grow in more strength, and then I can use it to help others.
Mm-hmm. Yeah, well said. And there's a lot of good information from what you've said today. So I appreciate you, Craig, coming in and giving us a lot of information around your expertise and working with these noble people that put themselves out there to help people in need. So I just wanted to thank you again for coming and speaking about PTSD, in particular with people who are first responders, police, firemen, firewomen, and this population. Thank you again for coming in. For more information, just go back to drkellyclarke.com, that website there, for more information around transformative therapies. If you yourself suffer with PTSD or other emotional difficulties and you would like to feel better, then just take a look at these resources. We'd be happy to help. Thank you.
Thank you.